How to use the Andorate Bronchoscope Valve Set in 8 steps. Thank you for purchasing the Andorate Bronchoscope Valve Set. The safer, stronger, and more sustainable valve set for bronchoscopy. In this video, you'll learn how to use this valve set in 8 steps. The Andorate Bronchoscope Valve Set is sterile and ready to use. It consists of one bronchoscope suction valve and one biopsy valve. Before using the device, familiarize yourself with the IFU provided in the box. Step 1. Depending on the procedure room setting, prepare a clean or sterile area, open the pouch, and remove the tray. Step 2. Take the biopsy valve out of the tray and put it aside for installation later. Step 3. Open the lid of the tray and push the suction valve downwards out of the tray to the clean or sterile area. Step 4. Mount the biopsy valve onto the biopsy port of the bronchoscope. The valve is correctly fixated when it covers the port. Step 5. This step is particularly important. Insert the suction valve into the port and align the suction valve arm with the white mark near the port. Step 6. Push the suction valve straight downward until you hear a click sound, which means the valve has clipped into the suction port securely. There should be no gap between the valve and the port. Now you can connect the suction tubing to the valve. Step 7. After the procedure is completed, firstly detach the suction tube, then release the suction valve by rotating it clockwise. You can now remove the suction valve from the port. Step 8. Remove the biopsy valve. Discard the suction and biopsy valves following your hospital practice for clinical waste. The important note is, do not place any upward force on the suction valve arm during installation, procedure, or removal. Now, we hope you find this video useful on how to use the Andorate Bronchoscope Valve Set. If you want to know any more details, or if you have any more questions, contact us at product@gahealth.com. and we will be delighted to assist.